Welcome to a broadcast of the recent Lorain County Commissioners' General Meeting. Unless otherwise announced, meetings are held Wednesday morning at the Administration Building, 226 Middle Avenue, 4th floor, downtown Elyria. These are public meetings and you are invited to attend. Agendas are posted prior to the meeting at www.loraincounty.us. Click on Departments to see the Commissioners page, then click on View Agenda.
Good morning. Can we stand for the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everyone. Welcome to the March 4th meeting of the Lorain County Board of Commissioners. Commissioner Lundy, do you have our word of the day?
Yes, I do. Our inspirational word for the day is, let love be your greatest aim.
Oh, that's
Nice and short.
very smart. And our dog warden has our beautiful little puppy today that doesn't want
That
to
I
come.
already love.
Yes,
Good morning.
Everybody loves.
Oh, my goodness.
This is kennel number 30.
I don't want to.
We're thinking maybe he's a schnauzer mix. He's going to get bigger. He's 3 to 4 months old right now. We have 16 other dogs in the kennel.
Oh, look at his little tail.
So come on down. This one goes up for adoption actually on the Friday the 6th.
Oh,
So
he's so cute.
I don't know who wouldn't want this dog, but
It's like, I don't want to go. I want to stay here.
you want to stay?
He's like, nope.
You're going to have to pick him up and carry him.
I'm staying.
This is a nice place.
Bye.
Hi, baby boy.
Oh, he's so sad.
All right.
How do you
meeting
top
adjourned.
that? You can't top that.
You can't.
Yeah, if you guys ready, we can have you come up first. Dave, long time no see.
Yeah.
Good
how are
morning.
ya? We really have to top the dog?
I know, that's hard to follow.
Yeah, right.
So, some of you may have heard this before, like last night maybe at the Chiefs meeting, but I wanted to give just a quick update on what's going on with COVID-19 and the coronavirus.
Who is he?
And kind of give some-
You need to introduce yourself. We know you, but
I
the,
apologize.
yeah,
My
thank
name
you.
is Dave Covell. I'm the Health Commissioner for Lorain County Public Health. So, obviously, there's been a lot of discussion about the coronavirus since it started, and I want to kind of explain why this virus is even important and why we even care about it. And I'm going to give you a little Virus 101 so you can understand it a little bit and why it's so important for us to kind of look at it. But I do want to give this one catchy line, if you will. There's a P word we want to talk about, and it's preparation, not panic. Okay, and that's the important piece that I think residents need to know. And so then we're going to talk a little bit about our systems and what we do. But let's start with a little Virus 101. So there are 2 words I'm going to talk about with that, and it's going to be shift and drift. Okay, and so if you think about seasonal flu, I just looked at the CDC yesterday, and there are 32 million cases of seasonal flu in this country this flu season, including over 18,000 deaths. So again, it's important to keep things into perspective. There's less than 100 cases of coronavirus in this country right now. So, but why are we concerned with one versus the other? And so let's talk a little bit about seasonal flu. So every year, your body recognizes seasonal flu as it moves through our community. Your T cells, your immune system recognizes that. And so every year it mutates just a little bit. And so as it mutates a little bit and goes into the southern hemisphere and back up again and starts coming our way, about 6 months in advance, we create, not me, a lot of people a lot smarter than me, try to determine what the flu shot should look like. And there's 4 chances to get it right. We look at the mutation 6 months out because it takes 6 months to make the flu shot. And then we look at 4 strains. That's why they call it quadrivalent when they talk about the flu shot. And they say, let's take our best guess of when it gets here, get as close as we can. Sometimes they're right on the money. And the flu, that's when they say the flu shot really matches this year. Sometimes it's a little less, but it still gives you some protection. And so what happens is your body, your T cells, recognize it a little bit from last year, and then when you get the flu shot, they really recognize it, okay? So that's why we always say, cover your cough, stay home when you're sick, wash your hands, and get your flu shot, because it allows your immune system to go after that virus. So the problem is when you have a novel virus, which is why they call a new virus, that's why they call it novel coronavirus, you have a problem. Your T, it shifts right from animals directly to humans. So your T cells, your immune system cannot recognize it. So the important part of that is that if it's deadly, your body will never get the chance to recognize it. And so that's why immediately we get concerned. And so the 2 things we're concerned with novel coronavirus was how contagious is it, how easy is it to spread, and then how deadly is it, what's the mortality rate. And so early on, we got to prepare for both. So that's why you see the World Health Organization, the CDC, and the local health department, the state and local health departments, all gearing up just in case. So now I've got good news and bad news. The good news is it's a little less deadly than originally thought because, again, you know, as more information comes out on this and evolves, we'll know more about it. So it's more like the seasonal flu when it comes to deadliness, if you will. So it's still serious, but it's not as bad as maybe Ebola or one of these other diseases that people are worried about. And so that's the good news. The bad news is that it's more contagious than originally thought. So in other words, it spreads like the flu, and the flu spreads pretty quickly, obviously. And so this is the concern. And so now we've kind of, over the last couple months, epidemiologists have been looking at it and saying it's pretty much inevitable that it's eventually going to come. Again, the good news is it's a little less deadly, but it does severely affect older adults and people with that are immune compromised. And so much like the seasonal flu. And so that's really where we're concentrating our efforts. And so I've been on the road tour here a little bit, on the road to talk a little bit about this with different groups. But I think what you also need to know is behind the scenes every day, here in Lorain County and all over the country, the CDC, the state health departments, and the local health departments are already investigating this. You haven't been to Wuhan, China, have you, Jim? Because we're going to have a conversation after. If that's the case.
He wants to be quarantined.
So, and just to let you know, this isn't the first time this happened. I've been in public health 30 years. We've had multiple times where this has happened. We had SARS and MERS a few years ago, and those were both more deadly but less contagious. We have Ebola when the person came on the plane. Again, more deadly but less contagious. And then we had H1N1, which was more contagious and less deadly. So it's not like this, we're not practicing for this stuff. We know. And so we work with the EMA very closely, and we have lots of plans and how to do this. And I have a whole group of nurses that are ready to go, and we've been monitoring people's temperature in this community for, you know, ever since this started. And so there's a lot of activity going on behind the scenes every day to protect residents. So that's the good news. So like I said, prepare, don't panic. A couple of preparation things I think you need to talk about, and I think Tom's going to talk about this a little bit here when it comes to the county. So a couple things. If you're a private business, you can imagine that this could be a problem in a few months if all of a sudden coronavirus is spreading through the community. You could have someone not know it, and they could walk into, if you have a tool and die shop and you have 10 employees, and that person could come in not knowing it and spread it, and all of a sudden you have 8 employees out, right? Just like they'd be out with the flu. And so the problem you run into is how do you prepare for that? You know, if you're a tool and die company, it's kind of hard. You have to either gear up your inventory or it's kind of hard to work virtually. But there are a lot of other businesses that are also trying to look at how would we work from home? What can we do? And so it's called a COOP plan, a continual operation plan. And I know Tom has worked with the county and yours. We have one. And all businesses should be thinking about how would you do this with social distancing. So let's say you have an office space that is kind of crowded. How do you make sure people can stay 3 to 6 feet apart and not sneeze on each other and cough on each other? And so those are some of the pieces that businesses should be looking at now. The other reason that there's a lot of concern is the economic impact. As we become a more worldwide manufacturing community, if you will, a lot of products are made in China. And so what's happened is those folks who were sick could not come back to the factories and make some of those products. And so you're having a supply chain problem with a lot of locations. And so that's why you're having an impact on the economy. But again, businesses need to be thinking about how do we do that? How do we adjust to that? And so that's kind of my, quick summary. I think I'm going to turn it over to Tom to talk a little bit about the COOP plan here for the county. And I have been talking to the cities, and I'll be talking to the city mayors and managers about how to provide city services, both police and fire and other folks, if a bunch of people are sick, right? How do you do both? And that's really an important piece for, I think, the county to be looking at now. So I'm going to turn it over to Tom to talk a little bit, and then we'll do questions and answers.
Thanks.
Morning.
Morning.
Tom
Hi,
Kelley,
Tom.
Emergency Management Homeland Security Director for the Commissioners. I was sitting here writing some notes down this morning, and I thought about of all the meetings we attend every month, and that's police and fire and township trustees and hospitals and nursing homes and things like that. I think we've been interacted more with Dave since 9/11 and his agency than anybody else. So, excuse me. The county has a number of plans in place. Number one is probably the biggest one is the county's emergency operations plan, which is completely redone every 4 years. We're in the process of going from cover to cover with that right now, and it's updated when we need to, like on a yearly basis. And Dave talked about the COOP plan, and we try not to talk in acronyms, so I'll do my best. But COOP stands for Continuity of Operations. And the clerk and I have been talking the last couple of weeks that needs updated again, and we've been working on how we're going to do that. So that's been in place since 2002. Now, so not only for something like that, but there's a fire in a building or something like that where you're going to do alternate operations and things like that. So that's in there. We've actually dry ran this before with one patient. If you remember, it's been 8 years, I believe now, when Elyria and Lorain still had health departments. The city of Elyria, Ely Elementary School had the first patient in Ohio that had the H1N1 virus. And that was a Sunday morning at 6 o'clock. Kathy Boylan called me and she says, we have this first case and we've got to do something about it. So by 8 o'clock in the morning, the County Emergency Operations Center was up and operational, like it's in our basement. And by noon, we had, there was an epidemiology group that went out, including the health department in Lorain County, went out and started interviewing who had contact with this child. And they were able to ring around who done it, and that never went anywhere else. But we were up like 4 days solid, making sure that didn't happen. So, I'm pretty confident with the stuff that we have in place and what we've done in the past. And I know even when they run flu clinics, flu shot clinics, we try to operate that as if it was something like this would happen, quarantine, that type of thing. We get people with radios at the flu clinics and in our county emergency operations center, someone there, and we practice taking equipment back and forth, even if it's a box of Band-Aids. So it's, those things are in place. So like Dave said, we're pretty confident we'll stop this thing in the tracks if we had to.
Good. Thank you.
Any questions, thoughts, concerns?
Do you want to
Yeah.
talk about the masks that you talked about last night?
Sure.
So everybody understands.
People are worried about masks, okay? Well, so first of all, an N95 mask, which is the mask that, that medical folks use, we have plenty of supplies right now, and the national stockpile has plenty of supplies for all medical personnel, including EMS. And as those run down, if that were to happen, there's a plan going on nationwide right now to make sure that gets moving. One of the concerns was that a lot of those masks are produced in China. And so therefore the production wasn't coming. And so there was some concern about that, but I wouldn't be concerned about that. I think that's something that we'll be just fine with. Individuals do not need to be wearing masks. And so, but there is something that has come out of this with some cultural issues where people get alarmed because they see someone from China or from another Asian country that has the habit of wearing a mask when they're sick. And so one of the reasons, this is a cultural thing because for many years in a lot of these countries, they've considered it rude to cough and sneeze on people. And so they wear an actual one of these loop masks when they have a cough, which I think is probably a really nice thing. I mean, and unfortunately, we don't do that here in this country. But again, it's really for them to make sure they don't spread it to their neighbor. But in terms of this idea that we have to start stockpiling masks and things like that, that is not necessary. Unfortunately, there are a lot of folks doing that kind of thing. And there's a lot of people making money on the internet. My suggestion is do not go to the internet and buy a bunch of masks. It's not necessary. And that brings up one last thing I really want to share. If you want good information on what's going on, here in Lorain County, you can go to loraincountyhealth.com, and we'll link you to every CDC handout you need, or the Ohio Department of Health handout you need, and everything here that's going on locally. Please do not accept what's going on in social media as the fact. Corona beer does not give you the coronavirus. You can't drive by a Chinese restaurant and get the coronavirus. These are not things that, now you laugh, but we have a group of people answering calls, and we get some crazy discussion like that. And so I guess my point is, if you want really good information, go to loraincountyhealth.com, and we'll link you to all of them. I would also say go to CDC directly, but their site is pretty big, and you got to navigate it. And so we actually help you navigate that by putting the important links on our site. So if you'd like, you can go to loraincountyhealth.com and just click on coronavirus, and it'll have a good information for you. By the way, there are 0 cases of COVID-19 in this state. 0. So keep that in mind.
Would you share with everyone the statistics you shared on flu versus flu deaths? All right.
So this is from yesterday, so it may have been updated, but the CDC right now says there's 32 million, at least 32 million flu illnesses in this year's flu season, which starts in September and usually ends here in April sometime. And there has been over 18,000 deaths from seasonal flu.
In the United States.
In the United States. And there are, again, less than 100 cases of coronavirus here in COVID-19 in the United States. So it's important to remember we're preparing, because you can, when it does show up, we're going to say, stay home when you're sick, cover your cough, wash your hands, but we can't say the last part, get a vaccine, right? Because that hasn't been developed yet. Hopefully, that vaccine is they're going to have a testing ability for a new vaccine sometime in the next couple months. And probably by the fall, they may have something that we can use. But from now till then, we may not have any vaccine whatsoever. And again, it all depends on how effective it is.
You also talked about quarantine and isolation, the difference.
Sure. So quarantine is when a healthy person who may have been exposed is asked to stay home and monitor their temperature for 14 days. Now, we know 14 days because we know that's the incubation period for this particular virus. Isolation is if you're sick and you have symptoms, we will isolate you while the test is being run on you, and that isolation will also occur in your home usually. And again, if that happens, our nurse will call you every single day. We'll have a nurse contact you every day and calm your fears and also talk to you a little bit about how you're doing. And again, right now the hospitals are not overrun with this. But the concern is to slow the virus down so that if we do start getting more and more cases, the hospitals can easily keep up. And that's really what it's all about.
Can you walk us through, there's a couple elements here that impact government, schools, universities. I guess let's start first with universities and schools, because I think a lot of this urgency started to surface at the same time I think the students were coming back from, reporting back to school. We have colleges and universities that are calling students back from overseas programs. I guess if you could just walk us through what's being done in those areas.
So actually, our Lorain County Public Health's main activity around this early on was working with Oberlin College, because they have about over 250 students from China, and some of them had gone back for the holidays, and so they wanted to be prepared when school started up again. So we were working. I was getting calls at 2 in the morning, and we were working with folks because they were worried, the worried well, if you will, but also to prepare in case something did happen. Now it's all turned out okay, and they've all been back and cleared, and that's great. And so we've been working with them a little bit. We've been working with them on a couple of issues right now, actually, and that is, do they want to call people back or not? There's some decision about where is this exchange and where isn't it. Some universities have done that, some have not, and some have done it only from certain areas like China and other, target areas, and some have done all of them. They said they brought them all back. So it really all depends on what that university wants to do, and we'll give them some guidance to do that. And I think the other, I think, bigger piece that people are concerned with right now is graduation. You noticed that last night there was an event canceled in Columbus that was, I would say, a little bit over what the real recommendation is. There's a recommendation for these big venues on how to have a successful event. They decided to limit the event anyway. So I know I'm meeting with the superintendents again on Friday. I've met with them for the schools multiple times because high school graduation is coming, right, in June. And so we need to be ready for high school graduation. Luckily, Oberlin College graduation is an outdoor event. We'll need to, talk to LCCC and kind of connect with them. And so as this comes forward and we begin to get more cases in the community, those decisions might change. And so right now, my daughter goes to Bowling Green, and I'll be going to Bowling Green for her graduation, I hope. And that's not until May. And so as those preparations occur, it really depends on how much virus comes into the community. So we're working behind the scenes with them quite a bit. And again, the superintendents have talked a little bit about when would we ever close a school. If you probably know that there have been some schools closed for seasonal flu, right? But they had huge amounts of people out, a third of the school out, right? So you can imagine that before, it's going to take a coronavirus a long time to really build to that. And so whether they make it all the way through the school year before that would ever occur or not, it really kind of depends on what happens. But I'm in constant conversation with the superintendent.
The first responder element, and I know there's some discussion about this last night when you met with first responders, and that is that I guess some folks were looking at the recent cases there in Washington State, and those, happened quickly. There was none, and then all of a sudden, 6, I think, is the latest number. But in what happens when the first responders then have to assist someone who has the virus, and what steps happen after that?
Right, and so first responders right now are already prepared for what they use as for in terms of precautions. But the concern is, if you start working on someone who you do not know has this virus, and then they all of a sudden become positive, now you're quarantining those individual first responders, and you can imagine if you did that multiple times, you would have half of your responders would be out, and so there's some concern on that. I don't know exactly what the guidance will turn into. Right now, unless you actually do work on someone who has COVID-19, then you do not need to be quarantined. In other words, if someone just comes in and they have cold-like symptoms or flu-like symptoms and you're not really sure who they are, until they're positive, you do not need to quarantine anybody. And so I think we're at least a few weeks out, at least maybe even months out before that's going to become an issue. But it could be, and that's where I've been talking to the mayors a little bit about what are you going to, you need to prepare for that.
And I know you stressed about the importance of, and I couldn't agree with you more, about getting credible information. I'm always blown away by what people believe on social media. But going to the right sites, the CDC, the State Health Department, your department. Tell us about, I know you've had some interactions with the state. You were expressing last night a great deal of confidence in the way that Governor DeWine and the Ohio Department of Health is handling the issue.
Yeah, so I've been through this. I have 30 years in public health, and I've been through H1N1 and SARS and MERS, and all the way back from white powder events. And this is clearly the most lockstep that this state has been. They really have done a fantastic job. But again, there's going to be times where someone's going to not follow the guidance, and then the state's going to have to come in and say, no, you need to follow the guidance. And they've just been great. And we had daily conference calls throughout the whole state of Ohio with medical professionals, public health, and the state health director. And that went on for weeks, and now it's every other day. And so tomorrow I'm going down to meet with the governor, the director, and every health commissioner in this state. Will be down in Columbus tomorrow to kind of talk through what's the next steps, what else should we be worrying about. And so that communication is going on all the time. And I'm communicating with Tom a lot and other people in our community. And so that we're trying to make sure we have a uniform message from public health. And so I mentioned this last night, and I'll say it, I guess, now. So I have 2 college students when Ebola hit, and I told them, when the media interviews someone, please listen to the person they're interviewing, the CDC person, the person from the state or the local health department, and what they say. Not an interpretation of what they say, but actually what they say. And that's the most important piece. There's a lot of interpretations of what people say, right? And that's all well and good, but it's really about the message coming out of the mouth of the public health professional. That's the person you want to talk to. And so the more we can do that, the better. And again, I was going to print out a bunch of handouts, but the day I print them out, 3 days later, it's going to change a little bit because we're going to have more virus moving in. So printing it is not as good. So now's the time to really use that electronic connection, right, and go to the appropriate site. So.
And Dave, last night, the final piece here is the subject of travel. And I did test the site afterward to kind of monitor where safe travel would be. Now, when they look at that site, and maybe you can explain what that is, what I'm speaking to, but that identifies the threat in that country. Can you speak to the idea of re-access, re-entry to the United States?
So if someone comes in from an affected country to this, so I mentioned this last night a little bit. One of the reasons that a declaration of emergency happened, a few weeks back by the federal government is because in order for the federal government to say, if you're an American citizen and you fly into the country, we need you to be quarantined for 14 days. They need a declaration of emergency. So that's why they did that. But that's really what's been going on. So if you come from a target community, you will be monitored for 14 days. If you have no symptoms when you walk in the country, then you'll be handed off from the feds to the state to the local, and we'll monitor you. And that goes on right now in Lorain County. And again, no one has been symptomatic and no one has been positive, and there's not even been a test because no one's had symptoms. But in Lorain County, but the key I think is that mechanism is there for all of those countries. Now, what'll happen when it becomes more prevalent in Italy and maybe throughout Europe is that could get a little more complicated. So right now there's no restrictions to many countries, it's just a few, and then there's also no restrictions in travel here in the United States. That could also change a little bit depending on how widespread it becomes.
Great.
The whole issue of you'd mentioned the other night, and I think it's important for people to know that, if you end up being quarantined, you were saying that mostly folks who immediately they have a concern about their own health and welfare, so they're going to be cooperative, right?
Yeah, so we've had this with Ebola and lots of others, and Tom mentioned H1N1, and so when I walk into someone's house and say, I need you to stay in this house for the next 14 days to make sure you don't have COVID-19, they don't argue very often. They're like, okay, you're going to have a nurse call me every day, that's great. Right. And so we've never had a scenario, I've never had in my career, a scenario of someone saying, no, I'm not going to stay put. And so, but if that happens, there is the authority of the health commissioner, the director of the state of Ohio, and the CDC to actually make it mandatory. And so we have some relationships with the sheriff and with the other police forces to kind of take care of that if that really happened. I don't anticipate that happening. People are very cooperative when it comes to that.
Mm-hmm.
How's the coordination going with the hospitals? You met with them on a regular basis, and
yeah. So they're part of the statewide call, and of course they're also part of our community health improvement plan. So I get to speak to them, with all the things that we're doing here. So we have a pretty good relationship, and our infectious control nurse contacts the infectious control for all of the hospitals and doctors' offices in this county regularly. And whenever there's a concern, there's an immediate contact, and she's got a 24/7 number, and so that happens. That can be 2 in the morning, or it could be during business hours. So we're in constant contact with them, and they've got clear instructions on what to do, and we have a pretty good relationship with all of them.
You also mentioned how initially out of the gate they would do the coronavirus test requiring 14 days. This is in different areas, rather than also testing for flu at the same time. And now that's kind of been something they've recognized and are treating that differently as well, correct?
Right. They're doing the rapid flu test now because, again, 32 million cases of seasonal flu. It's more likely that you have flu. And so they're doing a rapid cycle test for that so that they can, if it's flu, then they know already that it's not the other. And so that helps. Yes. And then if it's not the flu, then and they still are showing these symptoms, then they'll run the longer test, to find out if it is coronavirus.
You said transmission, coughing, sneezing, but if it lands on a hard surface and it dries, it's no longer contagious?
Right. Viruses in general do not survive very well outside the body, and people are worried about, I have to have this special chemical or something to clean them. That's not true. It's regular cleaning, just like the flu. It's regular cleaning, which is really what you need to do.
Because after you talked about that last, I thought about us as elected officials. We're out there, we're shaking hands all the time, and what about that? I mean,
So as this moves into the community and in cold and flu season, I'd recommend,
Fist
I hate
bumps?
to do this to you, but maybe you shouldn't shake so many hands. and
Fist bumps?
Maybe more fist bumps and things like that.
Hey, Sharon. Yeah.
Again, again, right now, it's not rampant in the community. It's
Right.
important to remember that. Flu season is going to start winding down here, and then we'll see what happens. And then over the next few months, you'll hear my message the message coming out from Lorain County Public Health will be, here it comes, and, let's get back like we're in regular seasonal flu season and really gear up and cover your cough, wash your hands, and stay home when you're sick.
right.
Great.
Any thoughts about just getting on a plane with all that recirculated air? I know that comes up.
Yeah, so my brother is an Alaska Air pilot, and he's, of course, going crazy right about now because the airlines are really worried about this. Yes, flu in general, travel is easier spread on a plane, and so COVID-19 will probably, coronavirus will probably be easier spread on a plane. So people will be a little nervous about that, but again, it spreads just like the flu. So if you cover your cough, we have had folks who wear a loop mask on a plane if they have a cough, and that's very nice of them. You can't. It's really hard for you to wear a mask and not catch it, right? That's not how it really works. I mean, those N95 form-fitted masks that the healthcare workers is one thing, but so when you get on a plane, there is a piece where people will have to be concerned about that. Again, cover your cough, make sure you wash your hands a lot. You get off the plane, wash your hands right away. Don't touch your face when if you're in those scenarios. So again, it'll be just like how to avoid the flu.
Right. Good.
And then if some first responders end up being quarantined, Tom, I guess we have all this mutual aid worked out with the communities.
Yeah, not only do we have it countywide, but we have it next door neighbor type thing too, but also there's the State Fire Chiefs Association. You can call 800 number, which is Columbus Fires Dispatch, and say, I need 20 ambulances. And they'll send them. We used to before when we had a water outage and we had tank trucks come in, we had cars, the county came in, the county helped us out. So just instantaneous, all I had to do is make that 800 phone call and it's ready to go.
Good.
Great.
Thank you.
Thank you for reliable information. I
Right.
think that's what we really need instead of misinformation.
Yeah, we'll probably want to, post that when we put together the production component of the meeting to make sure that all those websites are up there and available for everyone to see. But absolutely, go to the credible sources for the information. Don't even listen to the politicians. Go to the go to the health authorities for your information.
And if you do have folks that come to you, feel free to refer them. We're happy to answer their questions and kind of calm some fears.
And we can drink Corona.
You can, if you so desire. That's what's there.
Thank you.
Thank you.
for coming in. Okay, Madam Clerk, let's move on.
Under Resolutions Number 1, Investments.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Appropriations.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Transfers.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
No advances, no repayments, requisitions.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Travel.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Bills.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Authorize various personnel actions as indicated on the summary sheet for employees within jurisdiction of Lorain County Commissioners.
Mr. Cortez, you've been quiet down there today.
I got a lot of paperwork.
I see that.
Plus, it was quite interesting. I was just listening, as I believe the health director said, listen to the people on the
Right.
TV.
That's
So
right.
I listen to them.
Yeah.
It's always working. So,
Okay.
Thank you. I do have a number of issues I wish to discuss with the board this afternoon in executive session. Potential hires at Job and Family Services, maybe 911, Collection Center. But the biggest thing is we have ongoing labor negotiations with our 911 representatives of the United Steelworkers of America. That's been going on all week. I need to bring you up to speed on where we're at with that. Also, there's ongoing negotiations out the Sheriff's Department, just a brief update on that. And we're still working on a sale of real estate. So all of those topics are allowable under the Sunshine Act for executive sessions discussion. So I'd ask at the conclusion of our regular board meeting, we go into executive session and we discuss those matters that I've explained. Thank you.
Thank you.
Approve and waive the reading in the minutes of February 26th.
So moved.
Second.
Discussion. Kokoski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Authorize payment of $1,000 to Andrus Crematory and Funeral Home, Lorain, for indigent veteran Eddie Lee Hendershot, Lorain, in accordance with the ORC 5901.25.
So moved.
Second.
Discussion. Kokoski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Advertise notice to bidders for Lorain County Commissioner's Office for the fourth floor reception alterations, Lorain County Administration Building. Notice to be in the Chronicle on March 10th and 17th and open at 2 p.m. on March 26th.
So moved.
Second.
Discussion. Ms. Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Community Development, enter into partnership agreement with Overland, Sheffield Lake, and North Ridgeville for purposes of outlining the responsibilities in terms of compliance with Program Year 2020 Community Housing Impact and Preservation Program. The potential grant will be budgeted between the partners at $400,000 for Lorain County, $300,000 for Overland, Sheffield Lake, and $350,000 for North Ridgeville.
So moved.
Second.
Discussion. Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Job and Family Services, authorized purchase service agreement with Murray Ridge Production Center, Elyria, in the amount of $17,472 for cleaning services at JFS Building for fiscal year 2020, effective retroactive February 1st, 2020 through January 31st, 2021, and authorized director to execute on behalf of the Board of Prosecutors' approval as to form.
So moved.
Second.
Discussion. Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Authorized purchase service agreement with CallNet Call Center Services, Inc. to provide a telephone answering service for the Adult Protective Services Unit during non-business hours, effective retroactive January 1st through December 31st, 2020, at a cost not to exceed $1,500, and authorized director to execute on behalf of the Board of Prosecutors' approval as to form.
So moved.
Second.
Discussion. Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Sanitary reject bids received on February 11th for the Eaton Home Lateral Lining Phase 1 project, Grafton, Ohio, and re-advertised in Chronicle on March 6th and 13th, open at 2:30 p.m. on March 25th. Project was recommended to reduce stormwater inflow and infiltration into the sanitary sewer system. 15 sanitary laterals located within the public right-of-way Elm Street have been identified that will need to be realigned.
So moved.
Second.
Discussion.
Yeah, please. Is this the one that the bid got stuck in the mailroom? I'm going to speak to us a second. What occurred here was a bid had come in and was delivered to the mailroom, but it didn't leave our mailroom to go upstairs. And they did the bid opening, and the bid was submitted timely,
Oh.
but it wasn't available for the bid opening, which has to be done publicly. So I gave you new procedures, correct? And we're going to incorporate those procedures. So in order to prevent this, we only have one person in the mailroom. And sometimes that person's out and we're covering with other folks. We'll do our public bid opening no sooner than 3 days after the bids are due. And that'll give us plenty of time to make sure anything that's stuck in-house clears in-house. And that doesn't delay us very much. We just got to put that in our notice when the public opening is going to be. So, your lessons learned. All these years, this is the first time that's happened, but it was enough to reject bids. And we got to get this work done, plus the people submitting the bids work very hard on their bids.
Right.
And to reject them for a small technicality like this, we legally had to do it, but it's not fair to them. So we'll fix it.
Okay. Thank you.
Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Stormwater District award contract to Big Trees Inc., Columbia Station, in the amount of $83,523 for the Maple View Drive ditch restoration. Brown Home Township, 5 bids received on February 20th, this being the most responsive, complying with specifications.
So moved.
Second.
Discussion. Ms. Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Award contract to Marks Construction, Inc., Valley City, in the amount of $104,094.52 for the Carpenter Ditch Lateral Number 7 restoration, Eaton Township. 5 bids received, this being the most responsive, complying with specifications.
So moved?
Second.
A little bit on this.
Okay.
Don, was this a district project or a grant project?
It's under the district heading.
Well, it's under the district heading, but I can't remember what funding pool this was coming out of.
Mr. Cordes and Board, it's a community grant project funded, so it's a grant-funded project for
Through the,
Carpenter Ditch.
Through the SWAC funding we used?
Stormwater Advisory Committee recommended this
So
for
we
funding and board
voted
approved.
$66,000 underestimate?
Part of it has to do with, we had a property owner that decided to self-perform a substantial portion of the work in accordance with the design set up as is allowed by revised code. So they're building it to Peter's spec. And the purpose for doing that is that he wants to make sure that trees that we recommended clearing are kept in place. And we were fearful if we went and did it our way, we would damage the trees. And so
And all the bidders were aware of that?
Yes.
So how much, I know I'm asking you to tap dance here.
You got it.
How much did we put in the SWAC grant?
1 second, I've got Peter and Jessica here, see if they
Okay,
remember.
I'm just wondering if we pulled this in that, do we need to roll that into this year's allocation if we're gonna save that much money?
Oh, it will be whatever is made available.
Peter?
Do you recall the amount?
Peter Zwick, County Engineer's Office. Jim, are you saying the engineer's estimate was noticeably higher than the award?
Well, I'm just wondering if the estimate was 170,000, we would have had the allocation of funds before we went out.
So
We're gonna save a considerable amount of money on that project?
we're expecting to for two reasons. Number one, the construction bid was noticeably low.
Yeah.
But the estimate per the Ohio Revised Code, because this is a ditch petition project, has to include all the costs, including wetlands, consultants, and engineering, and even the 1 year of maintenance has to be added in. So that tends to increase
push it
the
up a little
apparent
bit.
cost,
But
estimate rather.
Well, we had that much SWAC money set aside from their grant monies. We're gonna end up with a substantially
some extra.
nice amount of money to go back into the.
Yes.
So my question to Don, and I didn't phrase it very well, was do we want to roll it back in this year?
I would,
Because we got a lot of requests coming in.
yeah, once we look at it, and at how much was awarded, I would feel comfortable in definitely releasing a portion of it. And that way, if there is a cost overrun, we're not worrying how are we going to pay for it if there's a change order needed in the field. But I would say that we probably would have additional thousands of dollars to add
tens
to
of
what we have.
Okay, so, yeah, it's gonna be good. 'cause,
Yeah.
Thank you.
Last year we ran out of money on that, on the grants. Maybe this year we can grab a couple of those other additional ones.
Yeah, currently we're at over $430,000 that will be made available this year. So we continue as projects come in under budget or under construction estimates in the awards, and we free that up for the next year.
Okay, and this is from last year, so if we
Correct.
can make an estimate, I'd like to free it up for this year's round of grants.
Yes.
Have a contingency, I understand, but that's going to be good news when we start awarding this year.
Yes.
It also
thank you.
depends on how the project scored, whether they scored high
Right, well,
enough,
you have to
so,
have enough
right.
projects that score above the
Right.
baseline, there's a
Right.
minimum.
Okay.
But last year they had a few that could have been funded, but we exhausted
Right.
the
Right.
funding.
And we've got some large projects coming in this year, so we can use every dollar available.
Right,
Thank you.
Good.
Thank you.
Thank you.
thanks.
Anything further? Kokoski?
Aye.
Sweda?
Aye.
Lundy.
Aye.
Under Transit, amend First Transit's contract for operations and maintenance for additional year effective retroactive January 1st through December 31st, 2020, and fixed monthly rate of $44,873 and hourly gate not to of $49.54.
So moved?
Second.
Discussion. Kokoski?
Aye.
Sweda?
Aye.
Lundy.
Aye.
Approve and enter an agreement with Lorain Metropolitan Housing Authority to provide transportation services effective retroactive to December 1st, 2019 through November 30th, 2020 for transportation services to transport residents of specified Lorain Metropolitan Housing Authority locations at a rate of $30 per hour.
So moved?
Discussion.
Speak on this just a bit.
Please.
This isn't just for Metropolitan Housing Authority, but the contract is with Metropolitan Housing Authority. Anybody can get on that shuttle. So it's out there somewhere. I have to talk to Pam, but we do have this stuff on our website somewhere. This usually, I believe, only runs 2 or 3 times a month in most respects, but it's not a direct, even though it's funded from Metropolitan Housing, everybody needs to be able to ride that, and it's no cost to anybody that gets on. So I want to get a little bit more out there about that, but they pretty much designed the route where they felt the needs of their community was, but they're well aware that anybody can get on that shuttle when they run. It's a good collaboration with Metro Housing, and it provides stops at supermarkets, drugstores, things like that, and it goes through the downtown areas where the other routes don't necessarily stop. So I just wanted to explain that it's not we're picking them up and just taking them from A to B.
Because we're not allowed to charter.
Correct. And of course, the rate that's there, the $30, we match with federal funds to lower the cost for everybody.
Because it's normally 50, isn't it normally $50 an hour?
Right around, our rolling cost is right around $50 an hour. So the $30 we match, we get another $30, and then that takes into consideration our administrative fees and things like that.
Excellent.
So it's a good way. A lot of people don't know we have all these little things going on.
Partnerships.
Well, trying to put them together. There,
The veterans, the Job and Family Services, Metropolitan Housing.
Well, we got to
Oberlin.
It's a scattergun approach because we don't have the ability to have enough revenue to be more precise. But wherever we can find a partnership, we exploit that to the best advantage of the community.
Mm-hmm.
Anything further?
That's it.
Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Approve and enter agreement with City of Oberlin to provide transportation services for connector and modified fixed route 2 days per week, effective retroactive to January 2nd through December 30th, 2020. City of Oberlin will provide the county with local funds in the amount of $24.77 per hour to be used by LCT as a match to an equal amount of grant funds in order to support the service, plus a $50 monthly fee to cover administrative expenses. No county general fund dollars will be used for said service.
So moved?
Second.
I will say that Oberlin has always been very progressive with regard to helping fund their public transportation needs in the city of Oberlin. I wish other jurisdictions would work with us. We have the ability to have more money coming into our community if we can get more match money. So without that match money, and I don't know if I told you before, but we've probably lost $15 or $20 million of potential money for lack of that much match money over the last 10 or 15 years, or maybe even less. So if these communities want to put on services, we can facilitate that within their communities like we have in Oberlin. And they've been good partners out there with us for a long time.
Excellent, yeah. Thank you.
Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Authorize agreement with First Transit to provide transportation services with Job and Family Services for non-emergency medical transportation effective retroactive to October 1st, 2019 through September 30th, 2020 in the amount of gate-to-gate hourly rate of $49.54 and monthly fixed rate of $9.38.
So moved?
Second.
Discussion. Kowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Under the engineer, approve and enter an emergency contract with U.S. Bridge Cambridge in the amount not to exceed $97,475 for immediate repairs to Robson Road Bridge 0201, Carlisle Township, to be paid from the Bridge Engineer Project account.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Approve and enter a VRR General Engineering Services Agreement with K. McCartney and Associates in the amount not to exceed $49,500 as part of a task order basis to be paid from the engineer project account.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Award contract to Sengus Construction LaGrange in the amount of $338,583 for the West Road Bridge 1427 replacement project, Pittsfield Township. 4 bids received, being the most complying with specifications. OPWC will provide 74% of the construction costs up to $281,200 as a grant, and balance will be paid from the MVGT funds. Issue notice to proceed upon completion of contract signed and work on or before July 15th to be completed by November 1st. Authorize administrator to notify the auditor to release retainage at completion of project.
So moved?
Second.
Discussion. Kukowski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Public comment.
Anybody wishing to address the board this morning? I don't see anybody.
Nope.
Nope.
Mr. Cortez.
I'm assuming you guys are going to talk about a few things, so I yield to council.
Mr. Innes.
I have two matters of pending, not new, pending litigation to discuss with you in executive session.
Okay.
Report.
Well, first, I want to congratulate Mayor Bradley on taking the realm of leadership there at the city of Lorain with his State of the City address. So, did a very good job with that. Really enjoy working with him. Just very engaging and definitely wants to get to the bottom line and get things done. That's important. Our Stormwater District held a get-together with all the members of the townships, the trustees, to discuss projects and initiatives and new ways of getting things done. Thought that was well received. It shows about the great things you can accomplish when everybody works together. The Lorain County Urban League held their Unity Chili Cook-Off on Saturday. That was very well attended. Sampled a number of different chilies over there and had a lot of folks participating in that event. That went very well. Just want to say thank you to our county administrator, to Visit Lorain County, to Lorain County Community College, everyone who worked on our Mardi Gras on Saturday. If you did not get a chance to attend, I would strongly urge you to attend next year. It's just it's becoming one of the most popular events of the year in Lorain County. And the food was just amazing. The entertainment was amazing. Just a great opportunity to get out and have some fun. I know we've had a mild winter, but normally when we have those harsh winters, it's nice to get out and have a nice evening with everyone.
You want the numbers?
So, sure.
Yes.
We had, in fact, we had 100 walk-ins, and I attribute that to, the weather being a little nice, although it was getting pretty cold that evening.
Right.
We had 750 total sales.
Wow. Yes, that's amazing.
And we fed 233 people. Okay, so, and again, break it out, we had 415 concert-only tickets. So it was pretty successful. I think the theater over there holds a little shy of 900. And you never want to get, I would say, much past 820, 830, because people don't really move in, and there's scattered seats. But it was a tremendous turnout. And, we learned a few lessons. It was 10 times better this year, and it's going to be 10 times better next year.
Mm-hmm.
But enlarging the venue is going to be difficult, because I really wouldn't want to push ticket sales past 8 and a quarter.
Mm-hmm.
And it's growing now. This is, we exceeded quite a bit from last year. And we can't feed any more people.
Right. Yeah.
So, that's going to be pretty much maxed out at about 350, 340 is going to be pretty maxing out the facility, especially since you got to move that many people, then move them to a theater, and et cetera, et cetera. But good numbers for us. I'll have other breakdowns in the next couple of weeks.
Good work to everybody on
Yes,
that.
oh my gosh.
It says you have to go to New Orleans to celebrate Mardi Gras, so
Right.
you can do it right here on the North Coast. So, but I can't say enough good things about always working with the community college and the culinary program and the students, and it's an amazing partnership. We're just so blessed to have the community college in this county. Also want to congratulate Radhika Reddy for launching the Ariel Hotel in Lorain. It's so exciting to watch the renaissance and the rebirth of Lorain, and it's unfolding right before our eyes. And I think for so many of us who had driven through the community over the decades, we always thought, boy, there's so much potential here. It's a beautiful lakefront community, and nice downtown historic buildings and access to the river and the lake, and it's coming together. It's coming together, and I think the streetscape downtown certainly was a big part of that. I think the Rocking on the River initiative has helped out a lot. Thanks to our community development department with all the work that's been invested into cleaning up the Black River, where folks actually want to be these days and do fishing. And now to have a hotel, I mean, our largest city in this county did not have a hotel. People were just always blown away by that. So, the hope now is that people want to come to the lakefront. We're trying to do as many things as we can to entice people to our lakefront. They now have a place to stay. I think probably a lot of folks will be doing, package deals, coming in, doing the Rocking on the River and staying at the hotel, enjoying the new food venues that are in downtown Lorain, catching a show at the Palace. It's great to see all the energy and the excitement, and we just can't thank Radhika Reddy and her whole investment group enough, because it really takes a lot of courage to step out there on the limb and bring back a historic building that I'm sure plenty of people would have wanted to see meet the wrecking ball. But it's a real renaissance right before our eyes. Very exciting. Congratulations, Victor Leandri and El Centro, for their nice leadership luncheon that they held yesterday. Had 100 people packed in there, and some words from Mayor Bradley and Mayor Whitfield. And then also congratulations to the Democratic women there in Lorain, held their spaghetti dinner last night, and thought that was a very nice event, and saw that my colleagues were on the front page of the newspaper for the not ribbon cutting, but I guess the recognition for the Barry Basco Bridge and the naming dedication. So that was very nice.
It was very nice. Does that complete your report?
Yep, that's it.
Okay. Wednesday evening, I had an opportunity to go to Sage and Seed at Lorain County Community College. It's a great dining experience by their culinary students. They are open on Tuesday and Wednesday nights for a limited time. Mr. Cortez, do you know how long that goes, the Sage and Seed?
It goes to early May.
Through May,
I don't have an
okay.
exact date, but there's plenty of time. Here's the thing, you got to call for a reservation.
Right, I was just going to say, you have to call for reservations, so.
Likely they'll turn you away if you do a walk-in, but reservation gives them a little more time to prep with the students.
Yeah.
Sure.
But like always, it started a little slow until people got the word they were opening, and now, open for a while, now people are starting to fill in.
Yes.
But it's great to work with the students. It's fun. You can see into the kitchen. You can see them working. They make them come out. I love how they make the future chefs come out and serve tables and work the front of the house,
So they
the
get to
back
see
of the
the
house.
whole experience.
Sometimes there's some slip-ups, but the food itself is amazing.
Oh, my gosh.
So, yeah, Sage and Seed, I wish I had the number with me, but you can find them. Just type in Sage and Seed, it'll pop up. Sage and Seed Elyria, it'll pop up with all the information you need, because they got it out there pretty good. So you can grab it from an internet search real easy.
Right. You won't be disappointed. Trust me. Thursday, we all attended the State of the City for Lorain. Mayor Bradley has brought a new spirit to the city that we should all be very excited about. Thursday evening, we had our annual stormwater meeting at Lorain County Community College to report out to the district of our activities. Our presentation included one of my favorite projects, which is the Lake Avenue Stormwater Retention Project. Not only does it help with flooding, but it is also a very cool and unique project. Unfortunately, one thing is that you can't see the good work that was done back there unless you have a drone. It's truly a hidden gem. We had a good turnout, and everyone seemed very positive about the work that's being done. Saturday was the party of the year, as everyone said, our second annual Mardi Gras celebration. It was bigger and better than last year, and we had more people. A warm-up band, Cats on Holiday, played as the people enjoyed their food tasting, and the food was exceptional. The concert was fantastic, and I'm so looking forward to this amazing event next year, and I believe it's just going to keep getting bigger and better every year. Monday, we all attended the ribbon cutting for the new Ariel Hotel on Broadway, and just have to say that her team is all women, and it's amazing to see. She came to our country with very little money, and what she has done is just amazing. So kudos to her and her team. The room was at capacity, if not more, for the event, because people wanted to participate in this very historical event. It was the first opportunity to view the rooms, and they were very well appointed with marble and granite and just beautifully done. It's going to be a really nice place to stay.
Beautiful views.
Beautiful views, a lot of pictures, like from the 1900s, early 1900s of the city of Lorain, just different, all over the city. It's really an amazing place. Tuesday, we had an expedited annexation hearing from Pittsfield Township to the city of Oberlin. Then we went to El Centro, as was said, for a leadership luncheon. The best rice and beans I've ever had. I have to find out where it came from because I have to get some of that. It was absolutely delicious. The mayor from both Lorain and Elyria had an opportunity to address the group, as did Dr. Ballinger from Lorain County Community College for issue 17. And so everybody get out and vote for issue 17. Commissioner Sweda and I had to leave there a little bit early to attend the ceremony at Lorain City Hall to honor Charles Berry for his sacrifice to save his comrades. And I was thinking after the fact, my dad was born about that same time, also went to Clearview, and I bet you any money they knew each other. Yeah, and my dad went to the Army where he had gone to the Marines. So what a sacrifice he made for his comrades that day. And then, as was said, Lorain Democrat women had a really great spaghetti dinner yesterday at Rosebud, and then we attended the Lorain County Community College to hear about the coronavirus information that you all heard today. So it was a busy week, and that's the end of my report.
All right, so I won't go into length. Yes, we had the mayor's address in Lorain, and that the new excitement and vibrancy down there. His team is an aggressive team, and see them accomplishing a lot very early on. Hope to see some sustainable change there. On Friday, I attended the North Ridgeville State of the Schools luncheon, and a lot of progress always happening in the North Ridgeville school system, and they discussed a lot of the accomplishments, their partnership with LCC. LCC has been a strong partner in North Ridgeville as well as other schools. So that was Friday afternoon. On Friday late afternoon, Commissioner Kokoski and I also attended just an observance briefing at the Justice Center. And we had a troubling situation where a young juvenile is being reprimanded, and they're deciding what they're going to do because he had hung a puppy. And very troubling, and it just kind of exposes some of the need for the good work that our Mars board is doing. We need to dig deeper. We need to reach out to younger and younger citizens in our community, because this was a very young man, and it's very troubling to see some of the activity that's surfacing. Later that day, I was able to attend the Smitty's mural ribbon cutting that was hosted by Tony Gallo and the Lorain County Chamber. Kudos to David Pavlik. He's with the Elyria Arts Council, and he actually was the artist on the mural. It was beautiful. And Friday night, I was able to support the AmVets Fish Fry in Amherst. Saturday's Urban League Chili Cook-Off was well attended, as well as a shout out to Paris Smith, who has been named their permanent director. And a thank you to our staff, to our administrator, everybody who made the Mardi Gras event the huge success that it was last Saturday. On Sunday, I was able to support the Metro Parks pancake breakfast out in Carlisle, and then in the afternoon, there was a spaghetti fundraiser for Bonnie Hitlin, a young woman who is facing liver cancer. So it was well attended, and nice to see the community draw together for a good cause. On Monday morning was the Grafton State of the City address. Mayor DiVincenzo has a lot under his belt for the last year, and they've outgrown the venue. So next year they're going to be determining where they're going to hold their State of the City address. And I just do want to also echo the sentiments and the praise for Radhika Reddy and her willingness to take such investment risk. I know she and I personally spoke about grant funding that was available, but that when you do engage in grant funding, you often go over budget because you have to make changes and alterations that you hadn't initially intended to do. And the fact that she stayed with that project, the fact that they are committed to making this a success in downtown Lorain. At the ribbon cutting, everybody kind of mentioned their happy memories of the old Broadway building, and I felt a little bit isolated because I remember going to the dentist there and making the decision that it was better to drill without Novocaine.
I did that
So
once.
I don't have the best memories. I like the new changes at the Broadway building or at Ariel Hotel. Yesterday, just echoing, we did the annexation. El Centro Leadership Luncheon was great. But the Corporal Berry dedication is just a solemn reminder of just how much our military personnel, the courage and the bravery that they must muster each day, as well as our first responders who never know what they're going to face in a day. And the fact that Corporal Berry could make a split-second decision to leap on top of a live grenade, I just can't even comprehend it. So that was great. One last thing for social media buffs, just to identify the somewhat flawed nature of social media news. No, the bridge is not coming down. There was a rampant rumor that the bridge had to come down, and I think it started by one of the workers went into the Subway sandwich shop there and made a joke that, oh boy, we found a problem today, and it took off. So, no, the bridge is not coming down. In fact, the new plaque will be sitting on the new bridge. So that concludes my report.
Board correspondence.
I move the reading be waived.
Second.
Discussion. Kokoski.
Aye.
Sweda.
Aye.
Lundy.
Aye.
Seeing no other business, I move that we go into executive session as outlined by both the administrator and assistant county prosecutor.
Second.
Kokoski.
Aye.
Sweda.
Aye.
Lundy.
Good idea.
This has been a broadcast of the recent Lorain County Commissioners' General Meeting. Unless otherwise announced, meetings are held Wednesday morning at 9:30 at the Administration Building, 226 Middle Avenue, 4th floor, downtown Elyria. These are public meetings, and you are invited to attend. Agendas are posted prior to the meeting at www.loraincounty.us. Click on Departments to see the Commissioners page, then click on View Agenda for a printable copy of the agenda.